Hello, how are you doing? Welcome to the new Ministry of Health. We've been sitting here talking to different people, and I have two more guests that are here. One has been here already, one is a new guest. I'm going to have them introduce themselves, and we want to talk about some very important information, and I want to ask a couple of questions. First, my name is Deron Cloud, pastor of the Soul Factory, and I'm a part of the new Ministry of Health. And then we have...
Hi, I'm Jaime Lavesseur. I'm also part of the new Ministry of Health.
Okay, and then we have...
Tara Heaton.
Okay, and I want you all to understand that you are from the medical profession as a nurse, and you're from the legal profession, right?
Right.
Okay, and so the question I need to ask you both. You blew my mind in the car while we were talking. Mm-hmm. As we got here, we didn't know we were going to do this segment, but since you've been in the medical field and you're in the legal field, what I want to understand is this form we signed, HIPAA. Mm-hmm. If we sign it, why do we sign it? And if we don't sign it, they tell us that first, they tell us there's going to be privacy, and then everybody's signing it. And so, Jaime, I'm going to want to ask you a question about this HIPAA. Tara, I'm going to ask you a question. Signing it, not signing it, what is this all about?
So, from my understanding, if you don't sign the HIPAA, it's your right not to sign it, and you'll still be seen by your doctor, but you're taking on the responsibility for payment to the doctor if the insurance company doesn't pay.
So if I refuse to sign it, then I've got to pay my own medical bill.
In
Right.
some cases,
In
yeah.
some cases. Mm-hmm. Wow. And so, and you all talking about that, what kind of information did you find? Because I'm believing that it's a privacy thing, and then I learned through Secure My Medical Records and that it's a deregulatory thing. And so, what are the drawbacks to HIPAA, and what did you all find out in your research?
Well, we started talking about HIPAA and then what happens to the information with insurance.
What happens to the information? Okay.
Yeah,
Right,
so
there's a false sense of security about your privacy.
False sense of security.
Right, because
Okay.
you believe that you're signing this form and all your medical information is now private and it can only be disclosed to who you give them permission to disclose it to.
Which every mother believes this and every parent believes. That's why
Right.
we sign it.
Right.
But in order for your insurance company to cover that visit, your doctor needs to submit to them what the diagnosis is. Which you wouldn't think is a big deal. Your insurance company just needs to know what you were there to be seen for, and then they will pay the doctor, and then you think that's the end of it.
Right?
But it's not.
You saying that's not?
No.
What are you talking about?
So what happens is your insurance company then submits it to a company that's known as MIB Groups, and they have 430 insurance companies as their members.
Well, stop. I just want to make sure it's not my own cognitive function and I'm hearing you correctly. What did you just say?
So your insurance company is then going to submit those diagnosis codes to a clearinghouse.
It's called MIB, the Medical Information
You're talking
Bureau.
about the Men in Black.
No,
Right?
medical.
That's what you're talking about. That's what you said, MIB, Men in
Right.
Black.
Right.
Right, and if you Google it, that's what
what's
comes
gonna-
up.
Right.
But you're telling me there's an organization called MIB
Right.
that does what?
They're collecting all your insurance information. All those codes are collected by them. Now, their excuse for this is that they want to protect the consumers from fraud.
You said that's their excuse.
That's their excuse.
Why do you call it an excuse?
Because it's still my medical records, right?
Right.
But now that they've made it a code, they're claiming it's not my medical records, they're codes, and therefore not protected by HIPAA.
And what do they do with the... You said not protected by HIPAA.
No.
So what do they do with the codes? What is the purpose of the codes?
Well, anybody that's a member of MIB can pay a fee to get your information.
Wait a minute. So now you're saying there are men and women in black who are behind the scenes that are getting our information that we don't know about.
Right, it's
Right.
a clearinghouse
A clearinghouse.
of information, of codes. So they keep bringing up the word codes constantly when you read about them.
Okay.
They're saying that we don't have your medical record, we don't have your medical information, but they have every diagnosis code.
Right. They don't have your x-ray, they don't have your EKG, but they have a code that says you were seen, and that's,
And what can they do if they have the code? If your insurance company or whoever gets this code or whoever gets it, what can they do with the code?
So this is the kicker, is that so any member can get this information. So life insurance, car insurance, and they can give you different rates based on that.
Right. So when you're going to apply for your health insurance or life insurance or long-term care insurance, whatever that is, what you don't realize is in the small print, you are agreeing to allow them to submit your name to the MIB group, and the MIB group will then produce a report about you to the insurance company, and the underwriters will then decide what your rate should be, if you should even be covered at all.
I've never heard of this.
Neither had we.
We hadn't heard about it.
We didn't either.
This is some serious. Wait a minute. So I'm joking. I know because I'm saying Men in Black, because Men in Black is an organization, even in the movies, that you didn't even know existed because it was in another realm.
Right.
And you're now telling me there's some other people that's in another realm, and they get our information, and all we know about is HIPAA, but we don't know about MIB.
Right.
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 I brought this up here. Y'all just dropped the mic. Y'all just dropped the mic.
And
because
they're-
people don't know this.
No, and they're making money off of that information. The insurance companies are paying to be part of their group, and then when they ask for your report, they get money for your report. So your medical information is for sale.
If you're waiting for me to say something else, I don't have. How many records do they get of the people in the United States?
There's millions.
Every single person that's seen.
If you go to a healthcare provider,
And if I try to go Google MIB, will it come up?
Eventually, but
Yeah,
you
you
have
have to look.
Yeah, you have to look deep to find it.
and they have done a very good job at putting out what they would like you to know about them, but it's very hard to find information written on them by anybody else.
Listen, you have worn me out, and you're saying HIPAA, and back HIPAA. It's almost like HIPAA's not relevant.
It's a false sense of security.
That's what you mean by that, Tara. False sense of security. Hey, listen. I'm having information overload right now. And I now I want to go do some research myself. And I'm not saying you guys are liars, because I know you speak truth and I know you're the gatekeepers. But you just dropped the mic. I don't know if you ever seen what they mean by drop the mic. You just dropped the mic on healthcare because you just exposed something to us that none of us know. MIB. I'm going to have to try. I don't know if I can say the word. I'm going to have to look this up on the internet and see if this is true. But guess what? You're telling me. I got goosebumps. I got chills because you're telling me that there's another organization that has access to my information and they're getting paid.
Yep.
That supersedes even HIPAA.
Yes.
I'm just going to reach over and say thank you for
you.
bringing the information. Thank you for messing me up. There's a song that's been, because we've been dealing with the new Ministry of Health for a long time, I just hear, didn't I blow your mind this time? Didn't I? I just want you to know I'm an old school person when it comes to songs. And you just blew my mind in terms of this is real information.
Yeah.
And if you have this information, how will it help you? I'm asking.
Oh.
I know you were mesmerized by my song
Singing
voice,
everywhere.
but go ahead, keep going.
So I think it's important that we know who has access to our private, personal health records. I mean, there's, to me, the information that I share between myself and my physician, I feel as though is private, and it's not something that I want everyone in the world to know about. You know, it's personal information. And to find out that it's in in a company, that other companies can get that information is unnerving to me.
It's unnerving to me because even though you mention it, just the reality of what you're saying, not to even know that there's another situation that we have to fight to be able to get our health care.
Right, and also, I mean, who knows if that information is true?
Is accurate, correct.
Right.
Because they can determine what kind of rates you get
Right.
on your life insurance or whatever.
Car insurance,
Right.
health insurance, all sorts of things, are based. Your rates are based on your medical codes.
You can contact them. They do have a website. You can contact them. Like a credit report, you are allowed to request a copy. You're allowed to do that once a year.
Which we both did.
We don't know what that process is if anything on there is inaccurate.
We'll get it in 15 days,
Yeah.
and we'll let you know.
Yeah. We're both like, we want to know, what is it, what do they know
So you're
of us?
saying you found MIB and then you found out that once a year
Right.
you can request like a credit
Yes.
Yeah.
report, but this is a health report?
Right.
Right. We want to know what they know about us. And we want to know, is it accurate?
Let me ask you, y'all said 15 days. How many days ago was that?
2.
Okay, I'll be back here in 14 days. I'll need a day of rest, and I want to come back, and I want to find. You ain't got to tell us. I know you've got some issues here, but I'm concerned about all issues. I was telling a joke, but I want to come back. Go ahead. What were you going to say?
No, that's true, and I don't mind sharing the information that I get if it can help other people.
Right.
Okay.
So, I don't mind exposing myself to, to the public, because I'm not ashamed of anything.
I
But
appreciate that.
because we want to get this, this truth out to people so that they know what's going on.
Hey, y'all, I'm without words, and it's not often for me to get speechless. But if you think you know something, then you find something else out that's bigger. Here's what I'm attempting to say. You're saying every doctor sends in their codes to this organization
To the insurance
Insurance
companies
companies.
to get paid.
to get paid. Wait a minute, to get paid.
Right.
All right, it's too much. I'm going to come back because I want you all to, I've done a lot of shows today, and I want to have a fresh mindset with this.
Okay.
Hey, you all, we're discussing something that's huge. Listen, you're hearing it first right here on the new Ministry of Health, that there are organizations that have codes about us, and we're thinking we're in privacy. I want to thank you all for making me hip to this HIPAA situation. And I want to thank you for telling me about the codes. And you mean CODE. But that's cold-blooded because I can't believe that this is happening. This is why we're on this journey, the new Ministry of Health. My name is Deron Cloud. This is Tara, and this is Jaime. And we are here to speak truth. We hope that you research, follow what we are, because it's our turn to take back control of our health with this kind of mind-boggling information. You have been equipped. I thank you for listening. I'll talk to you soon. I love you, and I beat you to it, and I thank you guys for joining me once again and blowing my mind. Love you all. Much love. New Ministry of Health, Deron Cloud. Talk to you soon.
Hello, everybody. Welcome to the new Ministries of Health. It's about telling the truth. It's about empowering patients to be better prepared to deal through the maze of the healthcare delivery system. There is quite a bit that's out there these days. That the latest buzz in the healthcare system has to do with the revolution in this country and around the world of the hemp products. And I bring to you today Tina Hand, was one of my colleagues. My name's Dr. Henry Lamoth. I'm an emergency room physician for the last 30 years. And Tina has had a history of health issues that has changed recently. And without setting the stage too much for her, I want you to meet Tina. Tina, welcome to the show.
Thank you.
Thank you. Tell me a little bit about what's it been like for you for as far back as you can remember.
I would say about 18 years ago, I was diagnosed with fibromyalgia.
Can you describe in layman's terms what that is and how that manifests itself?
Well, I started with body aches, really bad migraines, just feeling tired all the time. So I went to actually a Hartford Health and Migraine Clinic, and they diagnosed me there with fibromyalgia. They tried several medications that just didn't work for me. There's some ingredients in the medications that I'm allergic to. I have adverse effect to. So I've kind of been on my own since then and just maintaining with diet and exercise. So I didn't really have much help.
For 18 years or so, you have suffered with chronic pain from what you're telling me.
Pain, no sleep.
What is your sleeping pattern? What was that like?
2.5, 3 hours of sleep a night, tossing and turning. So not very good quality of sleep.
Did that affect your daily activities?
All day, every day. I was tired, exhausted, cranky. So it affected every aspect of my life. With my kids, with my husband, with work. So yeah, every aspect.
So the reason also that you're on the show tonight is to tell us your story. It didn't end there, surely. What has transpired since, and where are you now? And talk to us about.
I started. Well, I also had anxiety and other things. So I tried different things, yoga and exercise and other things, and those helped as well, but nothing really worked. So I started with terpenes and CBD oil and other things, and those have been working. And it's a new life now. I sleep way better. I'm sleeping 5 to 6 hours a night instead of 2.5, 3 hours, and I'm waking up in the same position I fell asleep in. So it's much deeper sleep. Feel better. The aches and pains are going away. More energy. Helps with anxiety. It's getting better every day.
Sounds like you're a new person.
Yeah, and people at home are saying it too, so it's improving.
Very good. You speak of the terpenes. There's so much out there. Tell us your decision-making step in terms of what worked for you.
Well, when I spoke to you about it, you had made some suggestions. I also had looked into it before. And the quality, it's the high quality terpenes and the brand that we chose to go with.
So in evaluating the market for terpenes and CBD products, there's quite a bit that has flooded the market recently. And in my evaluation of what's out there, the laboratory proven purest product that's rich in terpenes is from who I think is one of the best scientists in the terpene industry, Dr. Robbie Lawrence of Agora CBD in California. So I think at this point we came to the conclusion that it's something that you would try, and the results speak for themselves.
Right.
Is there anything else about the product? How is it to take? Does it taste? And
It's not bad. It's lemon flavor is what we went with, or I went with, and it's fine. Put it under the tongue and let it sit there for 60 seconds, and good to go.
easy to use.
Easy to use, very easy to use. And
Very
it
good.
works very well. Very happy with the results.
A testimonial of the value of the broad range of applications of terpene-rich products. Therefore, something that I think, thank you very much for coming on board. Thank you for sharing your story.
Thank you.
And I'm glad that the light is brighter at the end of your tunnel.
Yes.
Thank you very much.
Thank you.
Again, Dr. Henry Lamoth from the New Ministries of Health with Tina Han describing her positive experience over multiple areas of trouble that she's had over the 18 years or so that has been at least on a better path to less pain, less anxiety, and better sleep pattern. Thank you very much. Thanks,
Thank you.
Tina.